Treat urinary tract infections. Normally, urine that comes out of the body is already sterile. It is free of anything that could cause infection like fungi, viruses, and bacteria. Urinary tract infection, UTI, occurs when a small amount of any of these organisms were able to cling to the urethra's opening. They begin to multiply and soon will cause infection. For patients, infection can be translated to more frequent urination, discomforts around the bladder and urethra when urinating, cloudy and reddish urine, and general negative feeling. When left untreated, UTI can cause further infection to other parts of the body including the ribs and kidney. In that case, vomiting, nausea, and back pain will be experienced. Do not let that to happen by following the tips on treating UTI below. Consult a doctor. Most of the UTI symptoms are also signs of other diseases. It is important to consult your doctor to make sure that the cause of these symptoms is UTI and not something else. The doctor will require a urinalysis to determine the amount of bacteria in the urine. But for this test to be accurate, genital area should be washed and the sample should be the midstream urine. You can get the midstream urine by urinating a bit and then getting a sample from the remaining urine. The first stream of urine might have some sort of microorganisms, which might be determined as harmful bacteria. This is usually normal, so doctors recommend getting the midstream urine. Take antibacterial drugs. Any antibacterial drugs for UTI can be used for the treatment. But it's still a surer way if doctor was consulted. There are many drugs out there but only few are compatible for the patient. The doctor will typically recommend ampicillin, nitrofurantoin, amoxicillin, and trimethoprim for uncomplicated UTIs. More complicated cases will need more potent drugs like trovafloxin, ciprofloxacin, norfloxacin, and ofloxacin. Taking any of these drugs will already treat the infection within 2 days. However, doctors will recommend continuous taking of the drug for a week or 2 to make sure that the infection is really gone. Take a pain reliever. For cases of severe pain, doctors will often prescribe a pain reliever along with taking antibacterial drugs. Although completely safe, still consult a doctor before you decide on taking a pain reliever drug. Some of these drugs might have negative effect with the antibacterial medication. Also, follow the doctor's recommended dosage when taking this or even other drugs. Use hot compress to relieve pain. Some UTIs cause intense pain on the bladder. Feel relieved by applying hot compress on the area. You may add warm water in a glass bottle and put it on the area. Leave it for some minutes and then remove it. Put it again on the area until you feel relieved. Avoid things that have to be avoided. Drinking alcohol, coffee, tea, and soda will only rob the body with water. Spicy foods can be irritating to the bladder, too. Cigarette smoking has negative side effects on the infection as well as the medication. Stop smoking cigarette at least while you are under medication. See the doctor after the prescribed medication to check if you still have UTI. Gone symptoms can be signs, but these are not reliable. Urinalysis has to be done to make sure that there is no trace of bacteria, viruses, or fungi in the urine anymore. Only through this that the patient can be sure that his UTI has been treated.